All right, guys and girls, this is Jerningham here. Boris Johnson says too soon to say when the lockdown can be eased in. So,
The Prime Minister says it's too early
be
to say
eased,
when restrictions
England.
in England can start to be lifted, as some scientists suggested that pubs and restaurants should stay closed until May. The experts
Till
studying the
May,
spread of COVID said reopening the hospitality sector too soon could lead to another wave and unsustainable pressure on the NHS. Meanwhile, England's Education Secretary Gavin Williamson said he certainly hoped schools in England could fully reopen before Easter, something Downing Street refused to be drawn on. The rollout of the vaccination programme continues, with 65 new centres opened today.
It's the news,
Almost
lady, yeah.
5 million people have now been vaccinated, as our medical editor Fergus Walsh reports.
Life in lockdown has become the new normal. Most classrooms stand idle. Shops, pubs and sports centres are locked up. Holidays a distant dream. Protecting lives comes at a heavy price in ruined livelihoods and loneliness. And it seems there's no clear end in sight.
I think it's too early to say when we'll be able to lift some of the restrictions. We're seeing the contagiousness of the new variant that we saw arrive just before Christmas. There's no doubt it does spread very fast indeed. It's not more deadly, but it is much more contagious.
Labour too can't say when measures should be eased.
We need to look at the infection rates.
Yes, the Dear Come Labour Party. The one with Boris Johnson, the Prime Minister. You don't know who he is.
And we need to see those numbers moving. And there's no party politics in this. Everybody wants those numbers.
Labour,
to come down,
Conservatives, Boris Johnson, this guy's Labour.
Everybody complies with the government guidance.
Every month, Imperial College London sends out coronavirus testing kits to 140,000 plus people across England. It picks up those with and without symptoms, and the latest findings are worrying. The swabs were carried out between January the 6th and the 15th. They suggest that 1 in 63 people in England was infected, and there was no apparent decline in cases during those 10 days. Now that's puzzling, because if we look at UK-wide positive tests, there was a sharp decline during the same period from around 60,000 cases a day to around 40,000.
I think it's showing us that the lockdown is partially working. There's been a change in behaviour, and the epidemic isn't growing as fast as it would have done. But we need it to be shrinking right now. Kind of just keeping it levels not enough, given the pressure on hospitals and the number of deaths we have each day.
That's why vaccination is the hot ticket. This cinema in Aylesbury, Buckinghamshire is now a COVID vaccination centre. No popcorn on offer, but the chance for people to get a jab in the heart of their community. This mosque in Birmingham is the first in England to offer the vaccine. BAME groups are at higher risk from COVID, so centres like this could be important in increasing uptake and countering misinformation about the jab.
So there's nothing to be worried about. Mosque is open to tell you that this is genuine and this is in line with the teachings of Islam. Is there any other way of tackling this pandemic than the vaccine? I don't see any other way.
200 COVID vaccines a minute are being given across the UK. The aim by Valentine's Day to immunise all over 70s, frontline health workers and those shielding. NHS England data shows marked regional variations for the rollout. In the northeastern Yorkshire and northwest, around 2/3 of over 80s had received the jab by January the 17th. By contrast, in London and the east of England, only around 50% of the over 80s had their first dose. The southwest, Midlands and southeast were all around the 60% mark. Across the other nations, supply issues continue to hamper vaccine delivery.
Okay, here we are.
Less than half those over 80 have been vaccinated in Scotland and Northern Ireland. So in the race between the virus and the vaccine, it's COVID which still has a commanding lead. Fergus Walsh, BBC News.
Our political editor, Laura Ginsberg, is in Westminster. So, Laura, uncertainty about how long the lockdown can go on for, and concern as well in government about the small minority who continue to very openly flout the rules.
Well, Sophie, let's just take stock of what politicians have been saying today. I mean, the Home Secretary, Priti Patel, said that it's just too early to contemplate lifting any kind of restrictions and introduce a new fine for people in England caught going to a house party. The Education Secretary said he'd love to see schools back by Easter, but there was no guarantee. The Prime Minister said it was too early to be being sure that lockdown would be lifted in spring. Hop over to Northern Ireland. Michelle O'Neill and Arlene Foster extended lockdown there till March. In Scotland, it's already in place until the middle of February, and in Wales, there's no sign of anything unfreezing.
Sounds like an army helicopter in the background in London.
When we go through those list of remarks from the people who will make the decisions about this in the weeks and months,
It sounds like an army helicopter, yeah, in the background on the TV.
And the mood is one of real concern. Of course, there are signs that the disease may be slightly losing a little of its grip, cases flattening off, and of course, who could watch the images of vaccines going into the elderly's arms and not feel anything other than cheered or optimistic about the possibility of that, especially the way in which the UK, although it's patchy, is way ahead of so many other countries. But I think the mood among politicians is that this time round there is no appetite to rush this. I think there's a memory of the promise that was made to the country about how we might be able to celebrate at Christmas that then they had to go back on. So I think any talk of being sure that there will be a rollback of restrictions by early spring is very, very much a hope, certainly not a guarantee.
Laura Ginsberg in Westminster, thank you. Well, let's look at the latest government figures, and new cases do continue to fall. There were 37,892 new coronavirus infections recorded in the latest 24-hour period. On average, the number of new cases reported per day in the last week is now 40,485. There were 38,676 people in hospital with coronavirus over the 7 days to Tuesday. 1,290 deaths were reported. That's people who died within 28 days of a positive COVID-19 test. On average, in the past week, 1,224 deaths were announced every day. The total number of deaths so far across the UK is 94,580. Well, the UK's programme of mass vaccinations continues to ramp up with a new daily record for the rollout. More than 363,000 people have had their first dose of one of the 3 approved COVID-19 vaccines in the latest 24-hour period. And it takes the overall number of people who've had their first jab to very nearly 5 million people. Well, our medical editor, Fergus Walsh, is here. And despite the large number of people who have already had their first jab, there is still an awful lot of uncertainty about what is in the months ahead.
That's right, Sophie. So 5 million protected so far, 10 million still to go, because there are 15 million in those top 4 priority groups.
They're saying 5 million are protected of the coronavirus,
now, protection,
but they need this second jab.
Immunisation takes about 3 weeks, but
then it may slow down
then, it's not
with the second one. Who knows?
After the first dose. So given the very high rates of coronavirus, those who've been immunised have been told to be very careful.
Could be possible.
Stick to the lockdown rules
Time will tell, I think.
Now, and it's not clear they may still be able to pass on the virus. Now, there's no doubt that the lockdown is suppressing the virus, but if the outbreak is shrinking at all, it's not happening fast enough. More and more people are out and about than they were in the first lockdown, and we have this more contagious variant, and we see the effect on hospitals, nearly double the number of COVID patients as at the first peak in April. More ICUs saying they're either at capacity or nearly full. And until those measures in the NHS are eased considerably, the pressure there, then lockdown restrictions will remain.
Fergus, thank you.
Well, guys and girls, I hope you've all enjoyed that. I know it's sad news about the lockdown coronavirus rules. Lots of people are sick of it. I can understand that, but we just have to be patient. And some of us have lost our patience with this coronavirus. Most of us have had enough of the rules and just think sod it. But anyway, I hope you've all enjoyed the video. I hope it's helped a lot of people. Anyway, I'll see you in the next one. Thank you for joining me. Peace. Keep safe, peace.